Peace and blessings, YouTube family. Welcome to another edition from the Doctor's Corner. Hopefully, everyone has had a fantastic day today. Thank you for joining me for another conversation from the corner. Did you get your exercise on today? Did you do your due diligence today to minimize your opportunity or minimize your risk? Not your opportunity, but your risk for some form of dementia. For those of you that may just be checking in on a previous conversation, we talked about a phenomenal strategy. We actually found data that supported very strongly, in my opinion, some of the things that we could do as family caregivers, as elder caregivers, what we can do in terms of self care. That's pretty much been a theme of our discussions over this past week in terms of what we can do to best take care of ourselves so that we can be sure that we recharge and reboot, refuel, and be able to provide our family members, the people who we're taking care of, that we're providing that care for, that we can basically provide them with the best of care, right? Because I think we all would agree that when we are well rested, when we are of great sound mind, body, and soul, typically we put our best or our better foot forward in terms of whatever endeavors we engage upon. I'm certainly hoping, and to kind of continue with that, part of that data suggested that exercise was one of the number one um, techniques, tools that we could use to best position ourselves where we can minimize and reduce our own personal risk of dementia. And so I'm certainly hoping that someone on this line broke through in some kind of way and found a way to get them in, 10 minutes, 12 minutes, 15 minutes, 20 minutes, at some point today. And I love to know how you feel, right? I love to know in terms of how that motivated you, how that energized you, how did that carry you through the day, right? Something else from that conversation as we talked about, dementia, right? And, I got to thinking in terms of those of us who, have the roles and responsibilities of taking care of our elders on a day-to-day basis. This is our responsibility in terms of what we do day in, day out, 24/7. And I just kind of, in terms of just wonder, how many of you out there are actually dealing with, the family member that you're taking care of? How many of you are dealing with the struggles of some mental um, disability, disease? I don't really know exactly how to really frame it, right? I think medically, as we look, we here on the Alzheimer's. I think I'm on the Alzheimer's site here, Alzheimer's.gov, and they actually call dementia a disease. And so I haven't actually looked in the manual to see exactly how, um, it's actually termed in the medical field. But in any event, I'm just curious in terms of how many of you are struggling with that. And then, even a larger question, how many of you don't know the signs? How many of you are unaware of neurological deteriorations that may be occurring right before your eyes, but you don't really know or never thought anything that, that something's wrong? Maybe your whether it's your parent or whether it's, aunt, uncle, whomever it may be, maybe they've demonstrated a particular way for so long that it's become commonplace, right? And so I kind of like, just very briefly today, to somewhat talk about that a little bit. If we can have a conversation as it relates to that, in terms of dementia. Of course, I think a lot of us know that there are different forms of dementia. Of course, Alzheimer's appears to be, not disappears, but according to data, Alzheimer's is, the most known, most prevalent form of dementia. Lewy body is another form of dementia, and I got to tell you, um, what I've seen is um, these diseases, if we call it that, they can mimic each other, right? There are reports of people who have Alzheimer's, but they also have, whether it's consistently or whether it's sporadically, but they have some symptoms of the other forms of dementia as well. I think temporal lobe is another form of dementia, right? And so I just wonder, how many of you know the signs? If you have a family member, an elder family member who may be struggling with their balance, they may be falling a lot. Um, you may want to get that checked with your doctor, with their doctor, because that's certainly could be, a definitive sign that something's not right. Um, if you're in a scenario whereby you have to repeat yourself a lot, in terms of, maybe your family member is demonstrating the inability to be able to stay on script. And what I mean by that, in terms of, you're having a conversation with them, and you know how conversations normally flow, right? You say something, the person says something to kind of respond to that, and it's in sync. It's on point. If you have a family member that, in the midst of having that conversation, they lose track and begin to reply back to you in a way that does not coincide at all with the conversation, you may want to have the doctor check into that. That very well could be an indication that something is neurologically wrong, or um, could be a hint that, that could be some things that's unsetting. So even if it's not fully, hasn't taken full effect right now, these are signs that could be telling you that it's on the horizon, right? The if you got a family member who, constantly, appears to lose things in terms of money or keys, never remembering where they placed them, even worse yet, accusing others of taking them, that's another indication that you may want to have their doctor, um, provide them with an examination. If your loved one is maybe fidgeting around with their hands a lot, always just picking at their fingers, or picking, seemingly, at their skin or something, that could be another indication, right? Now, of course, some of these things, I think, hopefully you understand, it goes without saying, could mean other things too, right? But some of these symptoms that, we've discussed thus far are certainly closely associated with dementia patients, right? If you notice mood swings, whereby they seem perfectly fine at one moment, and the next it's as if another person has entered, their realm. Um, that may be an indication that you may want to have that checked out, right? You may want to have the doctor look into that to figure out, if anything is going awry. If they're constantly accusing you of, or accusing someone within the home of stealing their items or taking their items or moving their items, it's all because they can't remember, right? They can't remember that they placed, the $20 in the drawer on the left hand side of the bureau, right? And so immediately what they do is now, accuse you or someone of taking their funds, taking their items. If you by chance you have a family member that's, when they're watching TV and they can't make the connection between the reality of that's on TV and what's real sitting right next to them, if they have an inability, that is certainly a huge indication that some form of dementia may exist, right? But that fallen one, that you know, having a loved one constantly falling, that is a big one because, of course, most people just kind of look over that, right? Especially when you start talking about an elderly parent or elderly family member. You got somebody who's 80 years of age, 80 plus, 75 plus, right? Um, that may not be something that gets your attention right out the gate in terms of seeming unusual because we could associate people having less balance, less equilibrium as they get older. And so you look it over, right? You just kind of glaze through that and say, well, that's just part of them aging. That's just part of them getting old. When the reality is, there could be some much larger issues that are being prevalent and could be causing the falling, right? So I would just encourage you to pay attention, pay close attention to what's happening with your loved ones, engage and interact with them. If you have someone that's with them throughout the day, while you're at work or something like that, be sure that you have an open line of communication where, that nurse can provide you with pertinent information in terms of their behaviors and mood swings and that sort of a thing to help you as you assess what may be going on with them, right? So I just wanted to share that because once again I think for many of us, we find ourselves in these roles not really from a level of where it's been planned and it kind of you know comes along in a way where everybody is ready for it and prepared for it. For many of us, we're thrust into these roles and out of a necessity, not out of a strategy, not out of a plan, but out of this is what has to be done at this moment. And so when that happens, and remember those plates that we continually talk about, the proverbial plates that we're balancing in terms of lives and all the different things that we have to do for, this younger generation with our kids and our older generation in terms of our elders. It's very easy for you to go throughout the day, go throughout the week, go throughout the month. You're just running on the schedule, right? I mean, it's just because there are things that has to get done. It's very easy for you to miss some of these small signs that we've talked about, right? It's very, very, very easy for us to miss that. And I also want to tell you, I mean, loneliness is something that for many of our elders who are suffering from that, you'll be amazed at how quickly their mental capacity, their mental acuteness can diminish with that level of loneliness, right? And so I will just encourage you, if you're listening to this tonight, go back, as you engage and interact with your loved one, and really see them, not just look at them, but see them, right? Really be present in that moment of engaging the conversation and the level of the conversation so that you can be able to best position yourself as you get with their physician, their medical physician, to run tests or do whatever necessary to see if, in fact, they may be either suffering from dementia, some form of dementia, or they're on the cusp of becoming a dementia patient. So, in any event, family, I'm not going to keep you any longer. Once again, hope some of these tools, some of these techniques that we talk about would be helpful to someone out there. We'll love to hear your comments, see your comments. If this is beneficial to you, please, join the channel. Subscribe, hit that subscribe button. Hit that notification bell. And hey, listen, give me a thumbs up. I mean, as I've said before, what we like to do is grow this community, right? But I want it to be a community whereby it'll be a value. It'll be a community whereby it can be a safe haven for us to come in and sit down and have adult, mature conversations as it relates to our lives and the lives of the ones we love. So enjoy your evening. Have a great evening. And until we speak again, peace. Be well.